Evening, everyone. So, time to go ahead with our unknown class. Yesterday, we talked about aphorism 3. We are at present under the main section of knowledge of disease. We are into the voyage of blueprint of case taking. We completed about that the what kind of causes in what kind of disease taking out what points going to assist the physician to achieve the mission cure. Then, how to go about what all as a physician you need to do. That is aphorism 6, telling be the medical observer. And yesterday we discussed the article of Dr. Henneman in respect of the medical observer. We discussed the whole article, having many important points like your concentration, like having proving on yourself, or I added at least read the proving, then think that you are working for your mission. Also, you can think that I am being watched by this Almighty, how I am seeing my patients. And like this, there were some very good 4, 5, 7 points to be kept in mind to be the medical observer. But then again, this medical observer has to be unprejudiced, means the one observer, he should not judge anything in advance. Such a penetrating perception person, even that should not decide anything, judge anything beforehand. Simply listen your patient, note down the changes in the body and mind when he started falling sick. The sources are 3: patient, people around him, that family and all, and your observation. Altogether is called portrait of disease. And when you are able to get this portrait, getting this portrait hardly is going into so much of the investigation of interior of the vital force, seeing this spiritual being, that is vital force, is not going to help. Like, for example, I was reading a book regarding the psychoneuroimmunology. That is, the title of the book is Psychoneuroimmunology by Robert Adler. It is a laboratory work showing how the feelings, emotions going to affect in such a way that we get so many of physical illnesses like psoriasis, like cancer, like allergic rhinitis, and so on. They showed the complete lab work and proved that yes, it happens. But at the same time, where is the treatment? That area is completely silent. The work of the Master Henneman is such: you understand disease and you get the treatment. Then and there, seeing the totality of the patient, select the medicine on the law of similia, give it to the patient. It just worked miracle. And in my opinion, this is what scientific. But nowadays, very Surprisingly, so many of such people have come into very carefully defining this logic all in such a way and this scientificity in such a way that they try to keep these thoughts out of the boundary of scientificity. They put homeopathy and its experience out of the boundary of scientificity. Their job is to keep homeopathy out, and they are drifting away how to really help the suffering humanity. So that is not the whole idea regarding what we are discussing here. We must persistently focus on the understanding of master's work, that is the organ of medicine, so that we must be able to help our patient in a very quick and swift manner and in a very, very decided manner. So, in this way, the awakening regarding the homeopathy will raise so much that it will surpass all the definitions of scientificity and everything which is happening. We need to sharpen our senses more. We need to understand our principles in a more better way. We need to understand to apply all this understanding at the bedside, and we should be very quick applying it. Now, let us go further to the next aphorism, that is aphorism number 7. This aphorism is again the part of blueprint of the organ. This blueprint of the organ is a blueprint of the case taking. The blueprint of the case taking contains 5, 6, 7, 8, 4 aphorisms. This 7 is going to teach us that whatever the totality you are to find out of the portrait of disease, what we have already learned how to make this portrait of disease in the aphorism 3. That is where the aphorism 6 ended. Then now, what aphorism 7 says? Let us just see first the ending of the aphorism 6 and then start aphorism 7. It has a very important learning with us. What is that? That is, I'm reading 6 last words. That is, together they form the true and only conceivable portrait of the disease. Aphorism 7. Now, the first word is now, comma. That means what? You have conceived, you have understood, you are seeing the portrait of the disease as the given procedure in the 6 you have made. Now, after making portrait, now what is to be done? In this portrait, how to go about further. That is what is the meaning word now. As in the disease from which no manifest exciting or maintaining causes in the bracket causa occasionalis has to be removed. It has a footnote, very, very vital and important footnote. We can perceive nothing but the morbid symptoms. It must be the symptoms alone by which the disease demands and points to the remedy suited to relieve it. And moreover, the totality of these its symptoms of this outwardly reflect picture of the internal essence of the disease, that is, of the affection of the vital force, must be in principle, or the sole means whereby the disease can make known what remedy it requires, the only thing that can determine the choice of the most appropriate remedy, and thus, in a word, the totality of symptoms must be the principle indeed, the only thing the physician has to take note of in every case of disease and to remove by means of his art in order that it shall be cured and transformed into health. So we will be going one by one. What is this talking about? We understood first point, the first word now. We understood the job is half done, that we are able to make the portrait of disease. Now, in this portrait, as in a disease from which no manifest exciting or maintaining cause has to be removed, the next job for the physician is out of the portrait, which is a collection of all the symptoms noted with the help of senses by the medical observer, unprejudiced observer. Out of these symptoms, just to see which symptom is due to the exciting or maintaining causes, which are still manifested, which are still working. So, the most important job is when you are able to make the portrait. You have, say, some 30 symptoms in that portrait, mental, physical, whatever. For example, there are some symptoms: pain abdomen, burning in the epigastric region, and all such 3 4 symptoms are also there. And you come to know that the patient is taking for the pain in the knees regularly some painkillers. So, having this kind of substance as a painkiller and having such symptoms of gastritis, we can, after certain more questioning, find out that all such gastritis like symptoms are due to painkillers. And she is continuing with the painkiller every day. So, such symptoms which are due to the drug cannot be the part of the totality. So, we out of this portrait, we are to cipher out, we are to remove such symptoms which are due to exciting or maintaining cause. I told you, I gave you the example of maintaining cause. So, like this, there are many, many such examples you can see. Now, let us take some example of exciting cause. Suppose somebody got wet in the rain and he is with the wet cloth. And what is first to be done? Change and get dried up, or get the medicine first? You will say, obviously, somebody has to first change it and be dried up. Then only the question of medicine comes. Yes, it is such an obvious thing, and that is why Hellman, in totality of all these two types of causes, he named them under the bracket as causa occasionalis. And there in this has to be removed. On the removed word, there is a footnote. Very, very interesting footnote. You will enjoy this. And it is good that we should first read that, because that is rather more important to understand what this footnote says. It is not necessary to say that every intelligent physician would first remove this where it exists. As just now we talked the exciting cause. As you know, that is why Hahnemann says, not necessary to tell to the intelligent physician. So I am sure everybody listening me having himself or herself in the category of intelligent physicians. And there is no need to tell this that you are going to remove such exciting and maintaining causes first. And as soon as you remove such maintaining causes and the exciting causes, cause of occasionalis, so many of symptoms will pass off, will go away, will fade away itself. Then just imagine how can it be the part of totality in the case? It cannot be. Because such symptoms are maintained by either some exciting or maintaining cause. So Hahnemann says in the footnote, not necessary to say that every intelligent physician would first remove this where it exists, and we have to categorize ourselves in that category of intelligent physicians. Next, thereupon generally ceases spontaneously, as just I told. As soon as you remove, all that symptoms are ceasing itself. They will not further continue because the source is removed. He will be giving us certain examples of this exciting maintaining causes. In this footnote, we will be seeing those, reading those. He will remove from the room strong smelling flowers which have a tendency to cause syncope and hysterical sufferings. So, suppose if anything like having very strong smelling flowers, it affects somebody, that person who is very hysterical by this fragrance of the strong smelling flowers, that person is going to have a treatment from you for that kind of unconsciousness, hysterical complaints, and all. How will you go about? You will just understand this, remove these flowers from there. Is there any treatment required further? It is not really required further. Then extract from the cornea the foreign body that excites inflammation in the eye. Something fallen in the eyes. You're riding a bicycle, you're riding a scooter or a motorbike, and suddenly something stuck in the eyes, especially in the cornea. What's the job? Are you going to give first Lesia? Are you going to give some other medication indicated according to the symptoms first? Or the job is, first of all, remove that foreign body. Then only the question of medicine comes. Otherwise, it will erode, it will damage the cornea. Then these are the obvious examples. And Henman says, not really necessary to tell to an intelligent physician, but still he mentions why, you understand. Extract from the cornea the foreign body that excites inflammation of the eye. Next, loosen the over-tight bandage on a wounded limb that threatens to cause mortification. If any injured part, wounded part, if you really tight it like a very tight ligature, it is going to cause the gangrene of that part. What is the treatment? Obviously, loosen it. And what you will do, you will just loosen it, apply a more suitable one, lay bare and put a ligature on the wounded artery that produces fainting. If suppose there is a artery got wounded that requires to be tied up, that requires a ligature. Otherwise, so much of blood will run away because sometimes some suicidal attempts occur by cutting the radial artery. Are you going to give medicine like China for the loss of blood first, or are you going to stop the blood first? So, this is all very usual, very, very obvious examples he has given. Endeavor, next example, endeavor to promote the expulsion by vomiting of belladonna berries, etc. Somebody has taken such kind of substance like belladonna berries. You have to make an effort to get this vomit out. That may have been swallowed. Next, extract foreign substances that may have got into the orifices of the body, that is, nose, gullet, ears, urethra, rectum, vagina. I think, some 20 years back, I can remember suddenly a case. Can you hear me? Hello? Can you hear me? Okay. So, some 20 years back, I'm telling one case. A small child, mother came, and he was a very, very naughty child, and maybe some 4 or 5 years old. And he was playing with the, you know, this, the eraser. It was the very small one, very small eraser. And that child, being very naughty, he put it in the nose, and it went quite high in the nose. And maybe some one day passed when that mother brought that child to me. Now, when I saw what's happening, when I examined, I found this. I asked and confirmed, yes, he has put this eraser in the nose so high it went day back. I immediately referred him to the ENT surgeon because that has to be removed. And we all know very clearly that it may reach up to the point of Little's area, and removing this kind of foreign body from the nose may cause bleeding. And because everything is all the external injury, it requires the proper management, and the one who knows it can do it. I was not having all those instruments to remove first. Then, secondly, I have to be ready with the packing to really take care of if any bleeding occurs. So, all these kind of foreign bodies, Henman says, the first treatment is how to remove that from any orifice of the body, and so many he mentioned: nose, gullet, ears, urethra, rectum, vagina. Next, crush the vesicle calculus. If in the urinary bladder, if there is a very big stone, the requirement is to crush it. It is sometimes necessary to do this. Next example, open the imperforated anus and imperforated anus of the newborn infant, etc. Again, etc. has come. So, for example, so many children come. I haven't seen any case of imperforate anus, but many of you and I too saw these kind of cases where there is phimosis in the small boys, and there is lot of difficulty to pass out the urine. So it is necessary that such cases requires immediate surgical intervention. Here, this 7-8 examples, and with one etc. We must apply here as what we study in the surgery, that what is not the purview of dynamic medicine, which is not the area of the scope of homeopathic medicine. We need to be very clear about it if we are intelligent physicians. And in medical condition, very nice condition. So this is how he says that this is all required. Just imagine I gave you a case of nasal obstruction with a eraser. Suppose I was not knowing this footnote, I would have asked him, wait, I give you the medicine. I am repertorizing your case and I am repertorizing and giving him some medication. And being trusting on me, that lady would have been waiting for the action of my medicine. What all is the possibilities? Just imagine. And that is not right purview of the homeopathic medicine to be given. And definitely after removing that, maybe he is suffering with some allergy of it or any other conditions. Definitely some medications homeopathically required that should be given, but then first of all remove it. That is very important. Then, being now knowing this fact that the intelligent physician has to remove such exciting and maintaining causes. This is the next job of every physician after conceiving the portrait of the disease. Then what? Then further what? When you cipher out these kind of symptoms which are due to the exciting and maintaining causes, whatever remains, that is all very, very important. It is all that example when you when you make the butter out of the curd, and when you make the ghee out of the butter. It is almost the similar process. You should not stop at the butter. The portrait of disease is the butter. Next job is to get the ghee, that is the totality of symptoms. So getting that, what is to be done? You have to cipher all those symptoms which are due to exciting maintaining cause. Because as soon as you remove such causes, the causa occasionalis, all those symptoms will fade away itself. They will not remain. But then all those symptoms which are not leaving you in any cost, at any cost, such symptoms are nothing but the actual essence, the actual deviation of the vital force. It is the actual disease for which he is saying so many words. We can perceive nothing. What remains is, it is just nothing but the morbid symptoms. Whatever remaining means some 20 symptoms, and you ciphered out 12 symptoms because of the causa occasionalis. Now remain some 8 symptoms in your hand. They are the actual morbid symptoms, and rest is all removed. It must, in the bracket, let us read the bracket also. Regard being had to the possibility of a miasm, and attention paid to the accessory circumstances. So, in respect of these morbid symptoms, we are to give the proper care, regard that these morbid symptoms, remaining morbid symptoms, are from or due to some accessory circumstances. What is this accessory circumstances? What we studied in aphorism 5, the moral and intellectual character, occupation, mode of living and habits, social and domestic relations, all these sexual functions. All these are the variety of accessory circumstances we read in aphorism 5, and in this bracket the aphorism 5 is the reference given. So we need to give proper attention to these areas, because whatever the morbid symptoms are noticed are from these areas only, all the same. And whatever the symptoms are there, all the possibilities, so many of the symptoms are of miasms. So the morbid symptoms, it must be the symptoms alone by which the disease demands and points to the remedy suited to the suited to relieve it. So all these, I gave you the example that after 20 only 8 remaining. This 8 symptoms is going to indicate the remedy. What we are doing in our practice, we are not doing this ciphering of the symptoms. We just learnt a way of practice, simply collect symptom, make rubric, repertorize it, get the medicine. It is not going to help. It is all mechanical. Even if it is going to help, we will not be able to learn and do the same in the next case because we're not sure it will work. But the method here we are learning, that ciphering of the symptoms due to causa occasionalis out of the portrait of disease, what remains is the symptom which will itself very clearly indicate the required medicine. And suppose the 8 symptoms are such, I am not able to get the medicine. All right, take help of the repertory, not an issue. But then the process, the very process of ciphering the symptoms due to causa occasionalis should not be evaded in your practice. And it is generally not taught. Mostly it is being taught in the colleges that the portrait in totality is one and same thing. No, portrait is all symptoms together. But then when you cipher out, when you remove out the symptoms due to causa occasionalis, what remains is totality. 20 symptoms is portrait of disease. Remainder 8 symptoms, totality of symptoms. They are the morbid symptoms. And moreover, the totality of these, its symptoms. What is this? This outwardly reflected picture of internal essence of the disease, also called affection of the vital force. Whatever these 8 symptoms, it is nothing but the affection of the vital force. Affection means somebody got affected. Affection means that deviation of the vital force. These 8 symptoms are that affection of the vital force, which is reflected outside, reflected externally, can be perceived by the senses. So that is the outwardly reflected picture of the internal essence of the disease. So what is the right definition for totality of symptom? Totality of symptom is outwardly reflected picture of the internal essence of the disease, and it is nothing but the affection of the vital force. Must be the principle or the sole means whereby the disease can make known what remedy it requires. And this only 8 symptoms, this only the totality, this only the outwardly reflected picture, this only the affection of the vital force is going to indicate this medicine is required. That is something very important. The only thing that can determine the choice of the most appropriate remedy. This only 8 symptoms, this totality is the only way, this only job a physician has to perform, because this is going to indicate to a remedy, appropriate remedy, and thus, in a word, the totality of the symptoms must be the principle, indeed, the only thing the physician has to take note of in every case. Mind it. In aphorism 6, take note of nothing and do this and get the portrait. Here he says, cipher the symptoms, and ultimately, physician has to take note of it, that 8 symptoms. That symptoms which is minus the causa occasionalis symptoms. This is to be taken, this should be, a physician has to take note of in every case of disease, and to remove by means of his art, applying the medicine on law of similia, that is the art, in order that it shall be cured and transformed into health. And ultimately, what is going to happen? It is going to be cured, and it will transform that human being into the health. So, this is what the important job. Until and otherwise, we are going to do this, we will be in trouble. Now, in this aphorism, again, there is a footnote on the word totality, last but third line. On totality of symptom, the word totality, there is a footnote. What is this footnote saying? Let us see. A small footnote. In all times, the old school physicians, not knowing how else to give relief, have sought to combat and, if possible, to suppress by medicines here and there a single symptom from among a number in disease, a one-sided procedure. It is not one-sided disease. Just prescribing on some one or two principal symptom is a symptomatic treatment of what kind? One-sided procedure, which under the name of symptomatic treatment has justly excited universal contempt, because by it not only was nothing gained, but much harm was inflicted. Doing treatment in this procedure does harm. Simple. A single one of the symptoms present is no more the disease itself than a single foot is the man himself. A single foot cannot be man, single symptom cannot be the disease as a whole. This procedure was so much the more reprehensible that such a single symptom was only treated by an antagonistic remedy, therefore only in an enantiopathic and palliative manner, whereby after a slight alleviation, it was subsequently only rendered all the worse. As we all know, if you do such one symptom, two symptom treatment, and that too on antipathy method, it just relieve it for some time in the primary action, but then again it comes back with more force, hence there is a harm. So such harm should not be done. And definitely, if you do, it is going to do that harm. Some may try doing this with even homeopathic medicines, more harmful. I believe you will be trying to understand my point. Knowing this, how it is very, very important that all these things you are going to take care in a very, very careful manner, and you will not be doing all this mistake as we just learned. You will not do symptomatic treatment first. You will do treatment on totality. What is totality? Portrait of disease minus symptoms of causa occasionalis is equal to the symptoms of totality. They are the totality of symptoms. And that is the ultimate deviation of the vital force we can understand. And this remainder of the symptoms, they are not leaving the patient in any way, only one way. That is the indicated, homeopathically indicated remedy given will be helping to remove the whole disease and transform this sick human being to a healthy human being. This is the, in nutshell, understanding of aphorism number 7. Think if you have certain questions on it. Ask me if you have certain questions on it. If you are understood, definitely you're doing it. But suppose you find any questions here, just check with your practice. Are you really ciphering out those symptoms which are due to the causa occasionalis? Are you really taking care of causa occasionalis? What are the causa occasionalis patient is going with? In the meanwhile, I just give you one case. A young chap suffering with mania and very bad mania and being treated salutary, so-called salutary psychiatric drugs, not helping. And he became a very big pain for the family. And nowadays, if you want to take such patients somewhere, very difficult to get the treatment. Now, they approached me and that boy was seen. It was not possible to see, to get the patient here in the clinic because they were unable to manage. He was only seen by the telemedicine. And after a very thorough case checking, so many of symptoms have come. And out of that, so many of the symptoms are due to the drugs taken. I found out how I do. I simply know what were the symptoms before the medication. Before the medication, what are the symptoms? What are the symptoms during the drug going on? And what are the symptoms even when the drug stopped? That is what are the symptoms which are the actual picture. Rest are due to the drugs. And I got this thing that he was having an alternation of the mania, which is the destructive mania. He suddenly becomes destructive, suddenly change over and become very religious, doing so many pujas. And suddenly he will become very, very lascivious. And at the same time, I confirmed that he sweat on the forehead. And on the touching, it is cold. And he demands all the cold, juicy kind of things to drink. I gave this after the confirmation with all these symptoms of the mentals and a physical concomitant. This symptom has got no such reason which is due to causa occasionalis. No such symptom is due to causa occasionalis. And it was directly indicating the medicine to anyone, to me and to you. Everyone has read this, to Veractrum. I gave a dose of Veractrum CM potency because such kind of mental diseases where no such pathology of the physical level was there, I find this is the best suitable potency. Having this CM one dose, maybe she had 3 doses. Then, having these 3 doses, the first few days he showed some aggravation. That was again a confirmation. But then this aggravation was very, very transitory, and it was very, very transient, and for a short lived period went off. And I think now it is more than some 3 weeks. The boy is on placebo, living very happily in the family, and like this. So, point of narrating the case is such that you should be perfecting yourself to collect only those symptoms which are minus causa occasionalis. And such symptoms are only the symptoms of the disease, symptom of the miasm, symptoms of the accessory circumstances that is given in aphorism of 5, all 7 points. They are going to help us to prescribe the medicine required to get this deviated blood force back to the normal dynamic state. So this is all something what we can really understand regarding the aphorism 7, and I am sure that you are now very clear about the concept of portrait of disease, and out of this portrait, what are the symptoms to be called as totality of symptoms. And you all understand rest of the thing, that totality of symptoms are nothing but the outwardly reflecting picture of the internal disease, that is the deviation of the vital force, that is the spiritual being. This is the main purpose what for we are doing the case checking. This is what the actual purpose we should be really going into this. So we have very clearly understood in the aphorism 5 that what are the causes and how to investigate these causes to get assisted to achieve the cure. While case checking, the physician has to become a unprejudiced medical observer, and he will just focus on the symptoms narrated by the patient, by the family or the people around him, and what are your observations. Take those observations by your senses. Not like this, I am closing my eyes, I can see you are this. No, it has to be through the senses. When it is through the senses, things are easy to transfer, to show others. Stand by, people standing by, students standing by. Only thing is, you are able to perceive from your senses because you are given that training, and student is getting that training from you. So this is all something what we can really discuss about aphorism 5, 6, 7, all their 6 and 7 footnote. Let us just have a look regarding evolution of aphorism 6 and aphorism 7 in the appendix, so that this block can be very easily completed. We saw two aphorism 5, just he says aphorism 5, this aphorism appears first time in the 4th edition. Then to aphorism 6, what is he saying? The first edition contains the following omitted from the later edition. So from 2nd to 6th edition, what we are seeing aphorism 6 is a presentation of 2nd to 2nd edition onwards. But in the 1st edition, some portion what we see now of 7 aphorism was the actual aphorism 6 of 1st edition, which was removed. What was it? There must be a healing principle present in the medicines. Reason feels it must be so, but Its essential nature is not ascertainable by us in any way. Only its phenomena and effects can be ascertained by experience. So we need not to go into so much of the explanation. Just we can understand what we read in 6 is nothing but this aphorism is existing from 6th edition onwards, and before that, in the first edition, the aphorism 6 was something else. And similarly, let us see aphorism 7. To 7, this allusion to the vital force occurs first in the 5th edition. So we all know that the vital force it was added in the 5th edition. So that is what he is telling, that what is said as the affection of the vital force is added from the 5th edition. And another thing about 7 aphorism, second reference, aphorism 9 and 10 of the first edition are combined in this aphorism with some variations and additions in all later editions. So, what we see now as aphorism 7, it developed some of the portions of the aphorism 9 and aphorism 10 given in first edition of the Agrawal, and some more modifications in the write-up Hellman has done. So this is all about we know about the aphorism 5, the evolution of it, aphorism 6, and aphorism 7. So this is what generally we can just see the evolution part of it. Anything, any questions are you really going to ask me? I'm just really waiting for it. Since we are able to understand things in a very thorough manner, it is going to make aphorisms very easy. We will not be in that thought that so much of unlimited explanations required. Initially, it was really required, but I don't think so now that you need so much of the explanations. So we have still some 10 minutes. What we can do is we can just have a look with the aphorism 8. What it say? It is not conceivable, nor can it be proved by any experience in the world that after removal of all the symptoms of the disease and of the entire collection of the perceptible phenomena, there should or could remain anything else besides health, or that the morbid alteration in the interior could remain uneradicated. So he is raising a question that not really a question, but then he is giving the answer that symptoms, if all the perceptible symptoms are removed, and when says it means the disease from the interior also removed. Henman is not of the view that symptoms are deceiving. According to Henman, symptoms are the only and only source, only sole guide to understand the internal disease. And on that basis only you can treat the patient, cure the patient, eradicate the disease. And that is what he's saying, that this is not really possible. That if you remove all those things, then still disease remains. Only thing, are we that kind of right medical observer that we are able to really create that totality of symptom which is actually there by making portrait, by ciphering out the causa occasionalis, and the remainder is called totality, not the symptoms, totality of symptoms. There is a vast difference between symptomatic treatment and treatment on totality of symptoms. I hope this is going to give you a much better idea. We will be discussing tomorrow regarding the aphorism number 8 in detail, and there's a very important footnote here where Henman says that Hoofland was still saying that homeopathy removes the symptom but the disease remains. This we are going to discuss tomorrow because it requires a little explanation for the understanding. But just now I gave you just an idea about this aphorism, and with this we will be able to collect, understand the very important and basic understanding regarding the points to be taken care in the case taking. All the aphorisms of the case taking, they are only to be understood if we understand these aphorisms 5, 6, 7, 8. That is why it is called the blueprint of case taking. When we say blueprint, blueprint means a plan beforehand. So he is giving a planning beforehand and then giving the actual procedure of doing it, the methodology of doing it later on in the practical part. So, dear friends, I hope these are the very important immediate points as we are discussing about the aphorisms, and knowing all these points, the purpose is we apply. When you see the case next time, collect all those symptoms and see out of this collected some 20 symptoms, what are the symptoms due to any kind of occasional causa occasionalis. That is the exciting or maintaining cause. If you are able to do this, this is called ciphering of symptoms. Ciphering means removing, ignoring, casting off, removing of the symptoms which are of only due to causa occasionalis. Why we have to remove? Because if that cause is removed, the symptoms will go itself, go away. Or what is going to happen? They are going to interfere with the understanding of the drug because they may mislead. They cannot exist in the totality of symptoms, which is the only and sole way of getting the indicated medicine on the law of similar basis. So this is it for today. I hope everyone understood it well and not much of the questions. And if any, let me see another minute. If no such questions, we can really go further uh, from tomorrow. So looking forward, if you have any questions, let me know, or we can sign off today and we can discuss, we can start discussing aphorism 8 further. Thank you, everyone. So we catch up tomorrow again and see further aphorism 8 and its footnote onwards. Thank you very much.